Welcome back to What Matters This Week. I'm Lauren Maloney. We're going to talk about opioids, a real conversation about opioids right now. Burlington Mayor Miro Weinberger is here, and the opioid policy coordinator, Jackie Corbally. Thank you so much, both of you, for being here.
Lauren, thank you. Thanks for your attention to this, I think, still not fully understood issue and really important issue.
But we are making progress because the good news you mentioned, I think about 2 months ago, that Chittenden County is experiencing a 50% decrease, especially in 2018. And this is a big marker and a milestone, I imagine, Jackie.
It goes without saying. I think when we look around the country, there's no other community that has hit 50% decrease in fatal overdoses. When we look at our state as a whole, that is not the case. And we don't take that lightly. We really feel strongly in Chittenden County that lessons learned in our county need to be shared both within the other counties in Vermont as well as partners around the country. It's pretty profound to see a 50% drop in fatals.
I should also mention that your title, the Opioid Policy Coordinator, there's a lot of other communities. There's communities and counties in New York that are now, they're getting grants and they're having money to afford one. Mm-hmm. That goes a long way, I imagine, when it comes to helping this issue where it starts, mm-hmm. really in the community, mm-hmm. correct? Mm-hmm.
Well, we didn't have this position, of course, until 2016 was when we, Chief Del Pozo and I went to the City Council and created this position because it was clear to us that the opioid epidemic was growing. We were seeing large increases in overdose deaths during those, mm-hmm. 13, 14, 15, 16, 17. And so we went to the City Council. We said we were going to lead the city's response to the opioid effort out of the police department, but we knew it needed to be a public health response. And Jackie's background is as a social worker. We have also brought on people with epidemiology backgrounds and statistical backgrounds. We've had some grant funding and partnership with Chittenden County Opioid Alliance has helped make that possible. And I think that was to add that capacity was critical, I think, for the city to be able to take this leadership role, pull together the dozens of different agencies that now meet on a monthly basis in this meeting we call Community Stat, that has really driven an understanding of the problem in this county. We do a lot of focus on data. We've driven a public health response. We have an attitude of very rapid follow-up and deployment of resources when we see an opportunity to make an improvement, and then we relentlessly kind of follow up and look at what the results of those interventions are over time. It's been it's a terrible issue. We still are losing way too many of our friends, our coworkers, our children. But we are hopeful now that we are figuring this out. There are some real solutions to this problem. A lot of our initiatives, I think it's important to understand, are focused on expanding access and speeding access to the life-saving addiction medicines of buprenorphine and in some cases methadone. Burlington is not the only place in the country that has seen decreases in deaths. I think it's pretty clear if you look across the country, the places that are seeing drop-offs are places that really have embraced these life-saving medicines and are kind of overcoming the stigma and misunderstanding that's often attached to them. And I think that if there's one message that I hope comes out of the Burlington and Chittenden County experience, it's that embracing these life-saving medicines saves lives.
Jackie, in the 2.5, 3 years you've been in this position, we mentioned that big milestone. What else comes across to you as a big improvement?
Communication. I think that whether it's CompStat, whether it's in the police department, whether it's with our attorney offices, wherever it might be, we're not going to beat this epidemic unless we talk to each other, unless we break down stigma, unless this is a disease that is based in this. So communications, picking up the phone and calling, I think there's a level of acceptance to say maybe we should try X. We've done it a certain way for a long time. New approaches, people are anxiously wanting to be part of the solution, and I think that's one of the biggest things, are that people are picking up the phone and calling each other, whether it's in the CompStat meeting, whether it's in another of other venues in our community. People are talking. people are not shying away, and people are recognizing that this epidemic is killing folks regardless of race, gender, and financial stability. So I think that's what this meeting is doing. It's allowing the conversations to happen. I think we've done some pretty innovative things in our city, in our county. But what I'm most proud of as a social worker and as somebody who's been in this field for a while are the fact that we are having the conversations, we are actually talking about it, and we're not just saying it's not our problem.
Something, Mayor, you announced at the State of the City address was what's called the BPD arrest screening. Basically, having a frank conversation with people that come in, are arrested, and talk to them about addiction, treatment, etc. This is a pilot program, correct?
It is. We started at the beginning of April, so we're 6 weeks into it or so here, and we believe it to be the first program of its type. It kind of builds on these other pilots that have launched in Chittenden County in the last year that we think are having an impact, and that we're doing screenings very consistently now in the emergency room, at our needle exchange site, and a statewide effort is everyone who is admitted into prison is screened for opioids as well. But what we realized is there was this big population that we were coming into contact with that were being arrested by the police and that are at a high risk, a higher risk than the general population for having an opioid use disorder. Having that disorder is one of the things that causes people to commit crimes. And yet we're not reaching the great majority of those people who are coming into interaction with law enforcement. They were only kind of assured a screening if they went to prison. And that didn't seem right to us. So this is a effort to say anyone that the police come into contact with will be screened by someone with expertise in this area, someone like Jackie or others in the police department who have gotten this training. And people who screen positive are being offered immediate access, immediate access into treatment right there. We're still figuring out how to do this, but I think, and Jackie's the one that's sort of on the front lines on this, and I think can give us sort of the up-to-the-minute sense. But I believe we have some optimism that there's going to be some positive results from this effort.
We are screening folks. People, as the mayor made reference to, if there's a positive screen, we're offering access to treatment immediately. But if we don't get a positive screen, we're still offering treatment. We're using an evidence-based screening tool. What the screening tool is doing is basically opening up the door to dialogue, offering communication.
Reducing the stigma. And we've had a few folks come back to the police department saying, hey, I remember when I was arrested a few days ago, I'm interested in treatment. So we are, for lack of a better word, normalizing access. We want folks to know that regardless of your arrest status, if you are opiate addicted, if there are other substances, mental health, because it all fits together. Sure.
We are there to offer those resources, and if it means transporting you to one of those low barrier programs, then we'll transport you to a low barrier program. So I would say that you can't get much more treatment on demand than at point of arrest.
Jackie, something I saw you tweeting about too is meth use. I know NPR did a story about it. It's surging nationwide. Is that something that's becoming more prevalent or identifiable in the area?
We are not like our other states around the country, say the West Coast, Midwest, but are we seeing a spike in meth? Absolutely. I don't think it's at the numbers that would be critical like our opioid or crack cocaine, but we are definitely seeing folks who are arrested or cited, or people calling saying that their loved one is under the influence of meth. So we are paying attention to that. We are working with our local public health partners. We're working with our law enforcement partners, and we're working with our partners who are doing urinalysis screenings to see if they're seeing that. So we are very aware of it, and we are following it closely.
Okay. I know you wanted to talk about human trafficking because, the opioid use issues are all kind of tied together. Is this, we hear about it on a national scale, and it's hard to believe that it could happen in Chittenden County, in Burlington, in Vermont. But how big of an issue is it? Because I imagine you're addressing it, so it's noticeable.
I would say we don't know how big it is. We know it is. We know it's happening. We're coming in contact with women and men on a regular basis through law enforcement, through other venues where folks are identifying that they are either prostituting or trafficking in some capacity, both in the community and trafficked through larger venues in other cities. It's concerning enough that we are going to be dedicating our CompStat June conversation to this issue. There was an article written by Kate O'Neill, and I think a great article a few weeks ago that pointed this out. It's in our community, it is happening, and one of the roles and one of the successes that the mayor made reference to are that part of it is bringing those tough conversations to the table. And this is one of those conversations that people get uncomfortable talking about, but we have, in our community, we have got to recognize that we have pretty vulnerable people that are caught in a cycle of trafficking, and we feel strongly that we need to really examine it, look at it, and be part of the solution.
So I appreciate you both being here and joining us today. Thank you very much.
Thank you.
Thank you, Lauren. I really appreciate your focus on this.
We'll be right back on What Matters This Week.